website. We've got Dr. Ken Randall with Tennessee River Dental joining us today. Let's talk about teeth and some, good seeing you, Dr. Randall.
Great to be back. Thanks for having me.
Yes, yeah, welcome back. 35 million Americans are missing all their teeth in one or both jaws. This is alarming to me.
It's a big number, and unfortunately, it's something that really can be an issue for a lot of people, not just from a conscious about it standpoint, a mental standpoint, but certainly also a functional standpoint, and even being able to get adequate nutrition.
Yeah. Well, so should we be talking about prevention when we see alarming numbers like this?
Absolutely. In my opinion, prevention is by far the best strategy at keeping people healthy, whether it's talking about teeth or whether it's overall health. If we can prevent from having to get into some of these more complicated management scenarios, it makes life easier for everybody.
Yeah. Okay, when we talk about prevention, we're talking about brushing your teeth at least twice a day and flossing on a regular basis, right?
Absolutely. Brushing for 2 minutes twice a day, flossing every day, number of other different aids and that kind of thing, depending on specific situations. But those are kind of the fundamentals that'll really get you off to a good start as far as prevention goes.
And it's very important to go see a dentist, right?
Absolutely. There are areas on our teeth that our toothbrush and floss can get to readily, but there are also areas that oftentimes our toothbrush and floss can't reach. And so that's where we need some of these specialized instruments in a dental setting to help keep all that bacteria out of there.
Totally makes sense. Okay, 15 million people in the U.S. have crown or bridge replacements.
Yes, so crown and bridge replacements can be necessary for a number of different reasons. Sometimes it's large cavities, sometimes it's cracked teeth, sometimes it's a cosmetic issue that we're addressing. So a number of different reasons, but definitely something that is pretty common in our population, and that we do a lot of neat things to manage on a day-to-day basis.
3 million patients have implants.
Yes.
It's a lot.
It is, and the scary part is the U.S. actually trails a number of other civilized countries as far as the percentage of people missing teeth that have dental implants. We're far behind a number of other places around the world.
I'm going to ask hopefully this is not a stupid question, the difference between implants and dentures. Is that?
Great question.
Okay.
So dental implants are basically artificial tooth roots. So we can have an artificial knee if we have a knee replacement, or an artificial hip. This is the same materials, the same types of metal, except in our mouth that's replacing a tooth root. We can put crowns on top of those, and there are actually situations where we can put dentures that kind of snap into those, or that are screwed into those where they don't come in and out. So it's kind of the fundamental background for rebuilding teeth and mouths.
Okay, all right. I know 2 people in the last week and a half that they've had a root canal.
Yeah.
That's not fun, is it?
So it's interesting, and that's absolutely kind of the conventional wisdom about root canals. And there's a number of different reasons that a root canal might be necessary. The one that we certainly hear a lot about is one of these situations where there's a significant amount of infection. Long story short, it's difficult to get things as numb as we'd like them to be when there's that much infection. The other 95% of cases are ones that tend to be really smooth, but I guess fortunately we don't hear about those as much because it does go smoothly.
Yeah, good. That's good to hear. Dr. Randall, always good seeing you. For more information, Tennessee River Dental. Oh, they're good folks. 4845 Hixson Pike, Suite C in Hixson, Tennessee. 423-877-3848. TennesseeRiverDental.com. Be sure to brush and floss on a regular basis.